Kenny Kokenauer always enjoyed excellent health, so he was shocked when this happened.
I was taking a shower and I fell, and my whole right side just kind of collapsed. So I went out, I opened the door, and because I knew something was wrong, and I opened the door and went out and fell in the hallway, and my whole right side for probably 3 or 4 minutes, I couldn't move anything on my right side. And so I knew then that I was in trouble.
Kenny had a brain tumor.
When it comes to getting rid of brain tumors, a lot depends on where it's located.
Tumors near the surface can often be completely removed, but ones further inside the brain are hard to reach and can sometimes be only partially removed or not at all. That's the kind Kenny had. He was given 1 year to live.
But, you know, I knew I had to trust God. And, you know, doctors are wonderful, but there's only one ultimate healer, and that's God. And so that's who I turned to and put all of my faith in that.
Then Kenny got some great news from the world-famous Cleveland Clinic. He qualified for a promising surgery that, instead of cutting out the tumor, the surgeon leaves it right where it is, but inserts a tiny laser into it and burns it.
We so far have used it in patients where they have tumors which are located deep in the brain, which are difficult to get to or remove in totality due to the location.
It's called neuroblate. The patient is in an MRI machine. With great precision, a thin laser probe is inserted through a tiny hole in the skull. Using a computer screen, the surgeon steers the probe to the tumor. The tip of the probe releases laser energy sideways, heating and destroying brain tumor tissue in one direction while cooling and protecting normal tissue near the tumor. Kenny was only the second patient to have this treatment done.
I had been praying without ceasing, as the Bible says. I was praying without ceasing. And then I felt a relief. I felt that God spoke to me and said, it's going to be okay. And that's kind of where it's taken from there. I've been, you know, the surgery went great. And, you know, I haven't had any problems since.
That was nearly 2 years ago.
If you've been diagnosed with a brain tumor and are wondering whether neuroblate might be your solution, you can be evaluated right from the comfort of your own home.
Just call the Cleveland Clinic's neuroblate hotline.
We generally ask them to mail in a copy of their recent MRI, which shows how large the tumor is or where is it located. And then my neurosurgery colleagues evaluate the films. And if we think that we can perform the procedure, we generally ask the patients to come to Cleveland Clinic.
Kenny's imbalance and loss of movement in part of the body are two of the hallmark symptoms of a brain tumor. Others include vision problems, hearing loss, speech difficulty, a new seizure, or a headache that won't go away.
Any of these symptoms can basically alert someone to at least go and have an initial consultation with their primary care doctor.
Although doctors know the symptoms of brain tumors, they don't know why people get them. Studies indicate they may come from cell phone use, living near power lines and transformers, exposure to petroleum products like plastic, or ingesting chemicals added to our food and drinks. However, none of that research is conclusive. Kenny has no idea why he got his brain tumor, but believe it or not, he's glad he did and is grateful God led him to the neuroblate treatment.
I was always busy at work. I'd give it 60, 70 hours. And this whole experience completely changed my life to where, you know, I try not to work those hours, spend time more at home with the family, more time with our church. So it's basically got my priorities straight.
Lori Johnson, CBN News.